Hi everyone, my name is Valerie Brochet, and I'm going to be doing my slideshow presentation on Florence Nightingale and the environmental theory. Who was Florence Nightingale? She was born on May 12, 1820 in Florence, Italy. She is known to be the first nursing theorist and the founder of modern nursing. She was also a social reformer, scientist, researcher, statistician, and a pioneer of public health. She completed her nursing program at Kaiserwerth, Germany at the age of 31 after only attending for 3 months. She is the reason why nursing is one of the most regulated and respected professions in the world today. How Florence Nightingale's theory came to be. It was during the Crimean War that Florence Nightingale's views about sanitation became a foundation in her theoretical work. Florence Nightingale was asked by the Secretary of War to help tend to wounded British soldiers. The soldiers were dying mostly from infectious and opportunistic diseases due to patients laying in their own feces, contaminated water, scarce supplies of bandages and soap, rodents and bugs being present, and overflowing cesspools. She improved the inadequate environmental conditions of the hospital base and became known as the Lady of the Lamp, due to her making rounds during the night to provide emotional comfort to the patients. Before Florence Nightingale had arrived, the mortality rate of the wounded soldiers was at 40%, and because of Nightingale and her team, it dropped to 2%. What is the environmental theory? So Florence Nightingale believed that a healthy surrounding was necessary for proper nursing care and the restoration and maintenance of health. There are 10 major concepts to her theory, which include ventilation and warming, light and noise, cleanliness of the area, health of houses, bed and bedding, personal cleanliness, variety, offering hope and advice, food, and observation. Major assumptions. So for the first category being nursing, she believed that in one point in someone's life, they will become a nurse because nursing is caring for someone's health. She had provided guidelines on how to care for loved ones at home and how to think like a nurse. Trained nurses were to have the knowledge of scientific principles, skilled observing and reporting the patient's health status while providing care. The next category is person, and she referred the patient as the person. And the nurse is to perform tasks to and for the patient and control the environment to enhance recovery. When possible, the patient should perform self-care and be involved in their care overall. Next is health, and she defined health as being well and using every power or resource to the fullest extent in living life. She saw disease as a reparative process that nature instituted when a person did not attend to health concerns. And maintenance of health was through prevention of disease by environmental control and social responsibility. The next category is environment, and the nurse was to assist nature in healing the patient and to create and maintain a therapeutic environment that would enhance the comfort and recovery of the patient. So, theoretical assertions. Florence Nightingale believed that disease was a reparative process and was nature's way of curing the process of poisoning or decay, or a response to the conditions a person was placed. She was committed to nursing education and training. She wrote notes on nursing for caregivers and trained nurses, making the distinction between roles. She believed that nurses needed to be excellent observers, and observation was an ongoing task for trained nurses. She also believed that nurses should be using common sense in practice, along with observation, ingenuity, and perseverance. She also thought that people desired good health, and because of this, they would work with the nurse and allow nature to do the reparative process and would change their environment to prevent disease. Acceptance by the nursing community. Nightingale's theory is timeless and is as relevant today as it was in the mid to late 1800s and remains as a foundation of nursing practice today. Her theory has been reviewed and applied to the environmental principles and nursing practice. Cleanliness, ventilation, diet, quiet, and warmth remain as essential components in nursing care and has influenced modern sanitation and environmental concerns today. These include modern sanitation and water treatment. If there is a new building architecture, if that building has good ventilation within it, how to properly dispose waste, and the ability to control the room temperature for an individual patient. So in conclusion, Florence Nightingale's environmental theory can be easily understood. It has provided guidelines for all nurses. It's recognized how the environment can be harmful and highlighted the benefits of maintaining a clean environment to prevent disease. And her theory addresses three major relationships that include environment to patient, nurse to environment, and nurse to patient. So that concludes my slideshow presentation on Florence Nightingale and her environmental theory. And these are my references. And I hope you guys enjoyed the slideshow. Thank you.